Hello everyone, my name is Nicola Hart. I'm Head of Member Support Team for Down Syndrome Ireland, and this is one of a series of presentations for parents and teachers on supporting students with Down syndrome. It's about understanding and supporting students who have a dual diagnosis of Down syndrome and autistic spectrum disorder. We know that around 1 in 10 children who have Down syndrome also meet the criteria for autistic spectrum disorder. This is a much higher incidence than in the general population, where around 1 children in 70 to 100 typically developing children will have ASD, but it is lower than in other children who have an intellectual disability, where it's 1 in 5. The rates do vary a bit. You'll see rates from about 1 in 7 children with Down syndrome up to about 1 in 15 children with Down syndrome. And that depends a little bit on the assessments used. And the reason for the variation is that many children with Down syndrome will exhibit some characteristics of autistic spectrum disorder. And it's important to note that not every characteristic means that you need this dual diagnosis. But possible signs of dual diagnosis would be a higher number of sensory issues than peers with Down syndrome. Quite unusual play, often less social interactive play, more kind of routine play. So whereas a child with Down syndrome may try and include you in their play, may try and act out situations that they've seen, it's less usual for a child with a dual diagnosis. They may be more fixed on organising toys, lining things up, those kind of things. Fixation on routines generally is quite common. Poor communication is a difficult one because most children with Down syndrome will have a difficulty with developing language and communication skills, but poorer than expected given the Down syndrome. You might see more disruptive behaviour, often as a result of the poor communication, and impulsive behaviour as well. If you don't have the language skills necessary for thinking, then it's hard to control, to regulate your own behaviour. And it's worth you having a look at another presentation that I've put online about just language and communication in students with Down syndrome, because all these things will apply as well to students who have a dual diagnosis. Hyperactivity is something else which is quite common. Children with Down syndrome and autism combined may be more likely to show things like self-harm, particularly biting their hands, banging their heads, those kind of things. Poor sleep is often there. If you take a clinical history, you'll often find out that these are children who don't sleep very well. And there are two kind of patterns. There may be children with Down syndrome who were always a little bit different to their peers, but there may be others who seemed very similar and then went through a regression phase kind of later in childhood. When you look back at some of those things, any child with Down syndrome may have 1 or 2 of those, and any individual behaviour may have another cause. For example, hyperactivity can be associated with sleep apnea. That's a bit counterintuitive. You'd think that if a child wasn't sleeping, they'd be exhausted in the day, but sometimes these kids are quite hyperactive, maybe often kind of keeping going because they know if they stop, they may fall asleep, possibly. But that kind of hyperactivity is sometimes seen with students with sleep apnea. Many students with Down syndrome can be a bit fixed on routines. Poor communication, poor language skills are a real feature of Down syndrome, but usually children who have a dual diagnosis of Down syndrome and autism will find it more difficult to communicate than other children with Down syndrome. When we're looking at dual diagnosis, you're often seeing clusters of those symptoms rather than just 1 or 2. And the symptoms are severe enough to interfere with developmental learning. But often the key thing that people see is that the behaviour, that their developmental trajectory is differing from their peers with Down syndrome. So it's significantly different than would be expected compared to other children with Down syndrome. What does this mean for the child? And there is an additional diagnosis and label that can be actually helpful. Sometimes there are more resources available if you have a diagnosis of autism rather than just Down syndrome. The diagnosis often happens later, and not just like Down syndrome is usually diagnosed either prenatally or reasonably quickly postnatally. It's quite rare to have a delayed diagnosis with Down syndrome, but autism in typically developing children may not be diagnosed until 2, 3. And with students with Down syndrome, because of that kind of delayed development, then it's often diagnosed even later. But it is important to find out if there is that diagnosis there, if you have those suspicions, because learning styles may be slightly different to the peers with Down syndrome. They may need things adapted in a different way. The teachers and therapists that they work with may not have experience because it's a relatively rare presentation, and it may be quite difficult for them to find a peer group. They may find that they don't really fit in anywhere, and that's something that is a challenge with any kind of rare presentation. The family, it can mean they feel isolated. Often, if you come to terms with the diagnosis of Down syndrome, with the fact that your child is going to be different than you expected, often you then have several years later to face another diagnosis, and that can be very challenging for families. That can be quite difficult, and you can feel that you've lost your peer group, because after you had the baby with Down syndrome, you may have found a new peer group of other mums who have a baby with Down syndrome, but now you can feel that you've almost lost them too. Because it is such a rare presentation, then it's less likely that you'll find specific peers nearby, because if we look at around 65,000 children being born in Ireland each year, that means 100, 150 children with Down syndrome, but probably only 10 or 15 children who have a dual diagnosis. In terms of teaching, there are some differences. You do need to think about any kind of learning goals. You need to make sure that you've really carefully considered those goals and that you've thought about how that learning can be applied at the planning stage. You're going to need to use very small, well-structured steps, and you're going to need to consider maybe some of the teaching approaches that work with other students who have ASD. You don't need to underestimate these students. They will be capable of learning, but they may need more repetition, more consolidation, and more opportunities to actually put that learning into practice. Visual concrete examples, learning by doing. So it's not enough with these children if you're teaching the concept of same and different, whereas you might be able to do that visually with a child who has Down syndrome, with pictures and matching and finding things that are the same and different. With a child who has a dual diagnosis, you're probably also going to need to plan in learning by doing. So consolidation through action. So it's not enough to look at a picture of a pencil and a picture of a cup and be able to see that they're different, or two pictures of pencils and see that they're the same. You may need to actually stand up, go over to the cupboard and try and find two things that are the same and try and find something that's different. And you need to actually do that as part of your lesson. That needs to be planned in, that concrete experience. These structured approaches for consolidation and generalization are vital. You'll also need to be, particularly with children with significant communication challenges, you're going to need to be taking a total communication approach. And I'll talk a little bit more about that now. I'll talk about the need to be very responsive to the child in your class. You need to be encouraging everyday communication. You'll need to make sure that this child has a reason to communicate. So find out what they're interested in. If they're interested in football, you can build a maths lesson around balls. Or football players or something, you can build an English lesson, a language lesson around the things that they're interested in, and you're far more likely to get engagement then. You need to be careful not to anticipate needs. Often these children, because they have significant additional needs, may have an adult with them almost all the time. And it's easy to anticipate, to smooth the pathway so that they don't need to request things, that they don't need to ever request a pen, or because it's always there for them. So you need to make sure that you're not anticipating those needs. We know that transitions can be particularly difficult for this group of students. And we also know that they won't pick up on the language cues that other children will. So if you've said to the whole class, okay, so 5 more minutes and then we need to do something else, this is not a child who will have taken that in. You're going to need to make sure that you've put in other supports for a transition. Planning the day, or even planning first activity, next activity, having some kind of structure around what's going to happen is going to really help to support those transitions and to prepare the child for changes. You're going to make sure that you have the means to communicate. So you need to make sure you have a common language. If this is a child that mostly communicates through signs, then you need to make sure that you have some law of signs, and you need to make sure that everybody else has some law of signs, not just the staff, but also the other students. Really important to have that kind of peer communication element strong in the classroom. You need to know if a child is using visuals or PECs, you need to make sure that those are immediately accessible, and you need to make sure that the right vocabulary is taught and that the right vocabulary is available to them. You also need to be aware, and you may need to watch the session I did on vision and hearing difficulties. You need to be aware that the standard very small PECs type pictures may not be big enough for these children, because as part of the Down syndrome, then they also may have difficulties with visual focusing. They may not see things as clearly, so you need to make them bigger and bolder, and they may not see things as crisply. So you just need to be very careful that if they are using visuals, if they are using things like PECs, that they're visually accessible, that they are big enough, that they are bold enough, that they are clear enough. You also need to remember that behaviour is a form of communication. And so to watch how the child is behaving as well as what they're saying or doing. The child also needs an opportunity to communicate, so somebody needs to be there to actively listen. And even if a child is not talking, you can still be listening. You can still be watching. You will still know what kind of things they enjoy and what kind of things they don't like doing. And that's all coming in from visual information. So really important that you're very sensitive to the communication that this child is attempting, even if they're nonverbal. Nonverbal does not mean non-communicative generally. Help the child develop language skills. Well, in an ideal world, you'd be hoping that they're getting consistent speech and language therapy, and that you have some advice in the classroom as to how to adapt the curriculum to make sure that it's accessible. But one thing that you definitely will need to do is to target vocabulary development, to be specifically teaching new vocabulary and to be reinforcing older vocabulary. So really look at addressing words ahead of topics. Don't be trying to teach vocabulary and new concepts all at the same time. Address the vocabulary separately. You may need to target specific language, which will be useful to reduce frustration. So you may need to target signs or target short sentences that can be learned as chunks, that can be used in particular situations where there is a frustration. You're definitely going to need to provide opportunities for consolidation and generalization, but again, don't underestimate. Most students can learn, they just will learn a bit more slowly, and they'll learn a bit differently than some of the others. Behaviour issues can be more common in students who have a dual diagnosis of Down syndrome and ASD, and they can interfere with development and learning. They can occur for different reasons than other students with Down syndrome, and we will have a look at that now. If you look at my presentation on behaviour, my introduction to behaviour, then I talk there about every behaviour happening for a reason. Behaviours don't come out of nowhere. And the usual reasons, if you have a child with Down syndrome in your class, the usual reasons are escape and avoidance and attention. So they either don't want to do something, or they want you or somebody to pay attention to them. But when you're talking about students who have a dual diagnosis, then although those are still the same reasons generally for functions, may not be in the same ratio. So you may be looking at students who have a higher incidence of sensory issues, who may find it very challenging to be in noisy situations or visually intense situations. You will still see the escape, avoidance, attention behaviours, but you will see more of some of the others. In terms of sensory issues, it's going to be really important if you're trying to address any behaviour that you think may have a sensory cause to not try and eliminate that behaviour. You may need to take one of three approaches. You need to either accept that that behaviour is one of the child's quirks, or you may need to avoid the situation that sets it up, or you may need to find a replacement behaviour. So for instance, if you have a child who's struggling in, say, noisy environments, then you may need to reduce exposure. You may need to avoid the times that they're going into noisy or very visually intense environments, because they're just causing sensory overload and meltdown. So you may need to reduce those. Or you might be able to anticipate. So for example, if you know that you have a child who finds it very difficult to go into the hall when it's full because it's noisy, it's intense, it's full of people, then it may be possible to anticipate and to allow the child to go into the hall with an assistant maybe 5 minutes before everybody else, so that they're in the environment and the noise and the sensory experience builds up gradually. And for some children that will be fine. Others may need additional things like ear protectors and things to deal with the noise. It may be possible to anticipate, like if you have a child who struggles with new environments, then it may be possible to anticipate. And again, with school things, maybe link with the parents, find out if it's possible to make a visit to a place beforehand, so that when the child goes with the class, that they're not completely overwhelmed. It's also usually necessary to replace rather than eliminate behaviours that are meeting a sensory need. So if you have a child who's refusing to shake hands or engage with somebody because they have their hands over their ears, then it may be necessary to allow them to use headphones rather than trying to take the hands away. Or if a child is chewing their fingers and then all of their materials and things are getting wet, then you might need to find something that's age appropriate that they can chew, that is replacing the chewing the fingers, rather than trying to just stop the child chewing, which is probably a sensory issue. Maybe a habit, but is often a sensory issue. Behavioural quirks which aren't causing any major problems are probably best ignored unless they become very rigid and they start to interfere with learning. So this is like, the advice here is pick your battles, basically. If it's just something that's a behavioural quirk of the child and it isn't causing anybody any harm, particularly if you're trying to deal with other behaviour issues that are interfering with learning or causing harm, then you're probably best just ignoring those. In terms of finding solutions, these are children who may do better in smaller classrooms, at least some of the time, with staff that can be very sensitive and responsive and have the possibility to tailor programs to the individual. But it's really important, if you do have this special class setting, that there is a meaningful engagement with the mainstream, that there is a decent amount of time spent in mainstream settings, properly integrated into mainstream settings, so that the peer interaction and the modelling of language and social skills can take place. It's very, it can be very difficult to integrate from a special class into a mainstream school, because the rest of the school doesn't really take responsibility for this child and their learning, but it needs to be packaged so that the child has a meaningful engagement with the mainstream. Visual cues and lists can be hugely effective, along with practicing routines. So especially with issues around developing hygiene sequences, toileting sequences, body awareness, they can be useful with things. If you have a child who's only eating a very restricted diet, then to try and expand this, visual cues can be really helpful. Predictable sequences and routines can help the child stay oriented in the day, but try not to set them so that they're completely rigid. If you don't include some variation, you can be setting yourself up for difficulty in the long run. So, for example, like one thing I've seen is a child who had difficulty transitioning from the yard into the classroom. So the arrangement was that he could go in slightly early to the classroom and he could have a couple of minutes on the iPad while everybody else lined up and got in. So he was avoiding the highly sensory environment and he was settled in the classroom, and all was working very well until the day where the iPad wasn't there or was broken or something. And then it becomes very, very difficult for that child to cope because you set up a very rigid routine. So you need to try and have maybe choice boards for rewards so that you're varying the positive response to whatever behavior you're trying to promote. But definitely go have a look at, there's 2 presentations specifically on behavior, and mine is around this kind of behavior theory and the things you need to think about in terms of addressing behavior. And Fidelma's is specifically focused on behavior in the classroom. So do have a look at those if you're struggling with behavior. The other thing you need to think about, though, is that behavior difficulties are very often linked with communication difficulties. So you can often address these by finding ways to help the person with Down syndrome communicate more effectively, or by improving the way that you communicate with the person who has Down syndrome. And one example of this is a child who the only way he could finish an activity was to act up. He had no way of opting out of an activity in any kind of socially acceptable manner. So it became the pattern that whenever he had enough of an activity, he would start to act out. And because he hadn't been given an effective way of communicating, I would like to finish now, then that became a habit. So helping the person with Down syndrome to have a way of communicating the things that they need to, improving the way that you communicate with the person who has Down syndrome are both really important when managing behavior, but just when managing generally. Language is a social tool, and if you want students to start learning language and using language, then you really need to use it in that way. Language, if you've understood the meaning behind a communication, then really important to accept that communication. So accepting all kinds of communication. If you want to work on language structures particularly, then work on them in another setting. If a child has managed to get their message across and made a choice, then that's brilliant, and we need to respect that choice. And then they're more motivated to try and communicate their choices in the future. Social rules, you learn those by immersion and practice, and we need to make sure that students have the opportunity to learn those and to expect age-appropriate behaviour. It's very easy if somebody is struggling with their behaviour, with their language development, with all kinds of things in their day-to-day life, to treat them as a much younger child than they are. But if you carry on treating them that way, they will carry on behaving that way. So we really need to have age-appropriate models and try and support students to become independent. And again, don't assume, make sure that your behaviour doesn't reduce the need for communication. This is a brief presentation, and if you'd like to know more, then I would recommend this book. It's called When Down Syndrome and Autism Intersect, and it is incredibly useful if you're teaching a child who has a dual diagnosis of Down syndrome and ASD. So thank you for your time. You'll find more information on our website and the address is there. And you're very welcome to contact Fidelma, our educational specialist, or myself, Nicola at downsyndrome.ie. And thank you for listening to this today.